Continuing our updates of COVID-19 from the United States, New York remains the worst affected state in the U.S. with nearly 270,000 confirmed cases of COVID-19 so far. But a new antibody study by the state shows that the people infected could be far more. A preliminary survey found that nearly 14% tested positive for antibodies against coronavirus. The results were from a state program that tested 3,000 people across New York State. This means that 1 in 5 people who were tested for virus antibodies had them. The data now suggests that as many as 2.7 million New Yorkers may have been infected with the virus.
If the infection rate is 13.9%, then it changes the theories of what the death rate is if you get infected. 13% of the population is about 2.7 million people who have been infected. If you look at what we have now as a death total, which is 15,500, that would be about 0.5% death rate.
But even with the sample size of 3,000 people and other limitations of the survey, this means the fatality rate is far lower than what some experts feared. The accuracy of the antibody testing has also been a major question. Now remember, antibody tests are intended to see whether the person has built immunity to the virus. They do not test for the virus itself. But if this study is completely accurate, this implies that more than 2.7 million people across the state have now been infected, which is far greater than the 270,000 or so confirmed cases in New York so far. New York is currently using the antibody test only to track changes in the infection rate. However, New York City health officials have cautioned against relying heavily on these antibody tests.